On the fateful day of March 2019, Miss Sarah Akelo, a resident in Abako sub-county in Leptong district, had gone to fetch firewood for cooking, a typical chore for all rural women. A dog pounced on her, sinking its teeth on her leg before disappearing in the bushes. The dog owner advised her to wash the wound with locally brewed alcohol. 2 days later, she started barking like a dog. She is a survivor who lives to tell her story, having sought proper medical attention.
The owner of the dog only gave me alcohol as first aid, but the pain increased the next day. I became unconscious and was taken to a nearby clinic. I did not respond to the medication. I was later referred to Lira Hospital, where I was treated and healed.
A person who has been bitten by an infected dog and is under threat of, or is at risk of developing rabies, is also another threat to other human beings, because that person runs mad, and in the process that person also turns aggressive and can also injure other people through bites. Even the person who is looking after the patient can get bitten, and then the disease is transmitted through the saliva of the infected person.
This disease is almost endemic in that it is becoming continuous in areas of the cattle corridor. In some areas, we are looking at dogs and cats as the main source of transmission. We also have areas that are surrounding the national parks. There are also wildlife that are also becoming a source of infection, especially the foxes, the wild dogs and other animals that can cross to affect the livestock.
As part of the activities to mark the World Veterinary Day in Uganda, Dr. Sam Okech, a lecturer at the School of Veterinary Medicine and Animal Resources at Macquarie University, led a community dog vaccination campaign in this same area to increase awareness about rabies prevention under their umbrella body, Uganda Veterinary, with support from VSF Germany.
Every year, we celebrate the World Veterinary Day, and for us today we are in Leptong for a particular reason. About 1 year ago, we lost one of our professors who taught us a lot about surgery and about treating dogs. We choose to come and do for the community around the professor's home, offer them services that the professor used to offer. And we are giving this for free to everybody. Everybody who has brought their dog, we've vaccinated, we have dewormed.
Towards the commemoration of this day, VSF has supported with radio talk shows, has supported with school outreach programs, announcements, sport messages, to sensitize the community and ensure that people know why we should control rabies in the dog and cat population.
These people, they have come to treat our cats and dogs or animals. So mine has been treated. Now I'm going home. So I welcome them, then I thank all what they have done.
The district has the highest number of unreported cases of dog bites on residents, therefore a hotspot for incidences of rabies. This, coupled with lack of knowledge, attitudes and the high cost of drugs, means no dog had ever been vaccinated in the district.
Dog bites are a bit rampant. On average, in a week we can get like 5 cases of dog bites. Some cases are reported on phone when we are possibly out of office. Some cases are reported to the office when they're seeking care, when they're seeking post-exposure prophylaxis. If every dog and every cat, at least 80 to 90% of all cats and dogs in the homes in the district is covered, that would be good enough.
In Nakasongola district, a similar event attracted all stakeholders including donors, Makerere University students and the private sector in a drive to strengthen the prevention campaign to avoid unnecessary deaths due to rabies.
The client has brought this animal, as you can see it. This animal is seriously affected by mange. In Uganda they call it orukuku, of which this condition is transferable to human beings. So you see it is losing a lot of hair, and unless this condition is treated with a specific drug, this animal will continue losing hair until it dies. So I'm going to give this animal ivermectin, which is a drug of choice. First, it is a dewormer, but as well it works on the mange, which this animal is presenting. So we are hitting two birds with one stone. We are deworming the animal as well as working on the condition. So we are supposed to vaccinate this animal against rabies. As the public might not know, rabies presents, it is prevalent in animals, but it spills over to human beings when they get bitten by a rabid animal.
As UVA, we have tried to sensitize the population, first of all, to appreciate that the disease is zoonotic and of public health importance. We should improve on surveillance, we should improve on research, and also taking samples, maybe diagnosis of this disease, mainly in dogs and cats.
Mass dog vaccination is less costly and a proven strategy in preventing rabies in humans compared to treating a victim. The campaign mirrors a One Health approach where professionals from human and animal health field can work together to eliminate rabies by 2030.
So we believe with that our efforts shall further bring other partners on board. We are not doing this alone. We are doing it with local governments. We are doing it with the people. We are doing it with the farmers, with the dog owners, cat owners, and everyone interested in control of rabies. It is a global threat. Many people are dying. Many people are having dog bites, and there are so many neglected diseases, but rabies is one of them. And we know that most of the sub-counties or local governments are poorly facilitated. So our interventions as VSF and our partners is timely, and going forward we want to have more partners involved in this.